Much for joining the live. I'm Dr. Frank Cadle with the GetFitBeLean program that I use to lose over 20% of my body weight in 2021. Let's see if we can get things a little bit better adjusted here. Kind of working with limited space today. All right, welcome Woody. Welcome Minion Lover. Welcome Spirit Tar. Welcome Pawpaw. Good to have all of you here tonight. I really appreciate everybody joining me. This is a multi-platform live, so it does take a little bit of finagling, but hopefully you're all able to see it well, and we'll continue to follow as I try to carry the message of the Get Fit and Be Lean program. And last week we talked a little bit about calisthenics. Calisthenics are really the foundation of the exercise portion of the Get Fit and Be Lean program. And I chose calisthenics because they're free. You can do them anywhere. They don't require any enrollment, subscription, membership, equipment, and you can adjust the difficulty to your own abilities. Now, the next step is the portion control dietary approach. And the reason that I choose portion control is because a diet needs to be something that you have, not something that you're on. Welcome JDS, welcome user 38, welcome Sunrise. Good to have all you guys here. Thanks so much for joining. So, portion control, where does it start? Well, it starts with breakfast and it starts with measuring cups, okay? And I always make sure that I have a full set available and clean when I start breakfast because it's that first meal of the day. If you overeat, stretch your stomach out a little bit, you're going to have more reactive hunger responses later on in the day. And those stretch receptors that control the ghrelin and the hormonal triggers to your brain actually are a secondary part. The first step is just looking at your food. When you look at your food, if your food is in a very large container, it will seem like less food. Welcome Colton Bridge. Thank you for joining. Welcome Dan Likes and Debbie Ryan. Wow, we got a big turnout on TikTok tonight. Thank you so much, everybody, for joining. And so the portion control, starting with measuring cups, the other big and really irreplaceable thing is a set of kitchen scales. I really recommend that you focus more on kitchen scales than you do on the bathroom scale because the portion control approach will pay off in the long run. But it does take some time. Your stomach, if you've been overeating, will stretch to accommodate that increased caloric intake. And it takes some time for it to stretch down in response to eating. Hi, McDonald. Thank you for joining. Hi, Drexel. Thank you so much, Fozpack. Really good to have all you folks here tonight. So your stomach stretch receptors are one of the first things that'll start to improve. And if you limit yourself to single serving sizes of the food that you eat, then you can approach a normal dietary intake without having to eliminate a bunch of foods. I like food. A lot of the diets that are promoted commercially, I'm pretty sure were conceived by people that truly hate food. They want you to not eat for, 16 hours of the day, or they want you to not eat biscuits and pancakes. They want you to give up foods. And what I want you to do is I want you to expand your repertoire of foods. I want you to eat more different foods that you haven't eaten in the past. And the way that you're going to be able to approach that with the Get Fit and Be Lean program is with the 2 veggie goal that we're going to talk about next week. But as far as portion control is concerned, I hope you'll take a look at my Twitter feed from the past week because there's a lot of research that has been done on portion control, on the portion creep that we have seen over the last 20, 30 years in prepared meals and particularly in restaurant meals, just markedly increased. And I think if I don't know that anybody has looked at it, But I think if you look at the dishes that we buy, you might find that portion creep has impacted those to get larger and larger. And this is a big, important thing to focus on if you want to make. Am I a doctor? Yes, I am a licensed practicing physician. Thank you for asking. That was a question from Jagnell. And so if you can put a portion in a portion-sized container to where it fills the container up, that information will start telling your brain that you are going to get enough food, and you can already start working on being full before you even start to eat. And then if you will eat slowly and really focus on the flavors of the food, you'll allow your body to generate those satiety hormones that tell you when you're full and leave you feeling a lot more satisfied with a lot less food. And that becomes very important over time, because we're going to talk in the future about the thermogenic adaptation that I've kind of beaten to death in the past as well. But I want you to be aware that this is a change that's going to go on in your body. And the way that you can arm yourself and help yourself is to eat single serving portions. And because a diet needs to be something that you have, not something that you're on, I don't really worry about eliminating foods. I don't demonize foods like a lot of these quack salesmen that you see online. Welcome, welcome the Hot Grammy. Thank you so much for joining. Really good to have all of you guys here. Really big turnout. I appreciate it. So calisthenics, portion control. We'll talk about the 2 veggie goal. These are the 3 main things that I used to lose over 20% of my body weight in 2021. I lowered my cholesterol by 20 points, lost more than 5 inches off my waist. I lowered my systolic blood pressure by 20 millimeters of mercury. I did all of this without any medication. In fact, I was able to get off my reflux heartburn medication, and I did it without surgery and its risk of complications that can occur even years after you have surgery. Fat burner pills are a scam. Yes, indeed. I'm glad you're aware of that. And I think it's really important to kind of view all of this stuff that they're selling you online. Is there anything benign muscle? Okay, so when you have a diagnosis, and your diagnosis has multiple syllables, what you don't want to do is go fishing around on the internet for a solution to that. You want to develop a long-term, ongoing relationship with a specialist or a subspecialist and continue to see your doctor even if you don't get immediate results, and recognize that there's not a solution for everything. Welcome, Elk River. Good to have you here. Hope this doesn't overstimulate you. And so, yeah, that's something you're going to need to discuss. You've been to 2 neurologists. I'm not really sure why you would think that a guy talking about nutrition on the internet would be the answer for you. I think that you should continue to focus on your physicians that you already have. All right, Carlos, does bariatric work? So bariatric surgery is actually the most dependably effective approach to morbid obesity, people that are 100, 150, 200 pounds overweight or more. And there are a variety of different types. Dr. Terry Simpson on TikTok is a bariatric surgeon, can talk a little more about it than me. I'm an old school guy, and if it ain't broke, don't fix it kind of thing. So I have a real hard time taking a patient who is anatomically intact, cutting them open and rearranging their organs for my goals. Usually when I'm doing surgery, it's for people that have dead bowel or incarcerated hernia or aneurysms, stuff that's going to kill them if it progresses. And that's true with obesity, of course. But, I've seen personally, I've had a couple of real nightmares come into the ER at years after having bariatric surgery, when you can have internal herniations. And, another problem that is the case now is that you have these surgery centers of excellence for bariatric surgery. People travel there, they have their surgery, they come back. They may not know which type of bariatric surgery they had, or if they know, it may be something that your local surgeon covering the ER isn't comfortable with. And so then it becomes a real hot potato of who's going to take this nutritionally depleted patient. And I've seen them in the ICU for 6 weeks at a time. So, yes, bariatric surgery does work. Yes, I would love to spend time with Leonardo da Vinci, but 5'10", 300 pounds is definitely morbidly obese. Usually when people talk about morbidly obese, they're not talking just about the weight, the BMI. They're talking about the outcome from that, which is the diabetes, the insulin resistance, the hypertension, the shortness of breath. There's a lot of different medical conditions that can arise that are related to obesity. And typically when people are candidates for surgery, they have some of those in addition to just the obesity. Consumer has to choose between the best medical treatment and the most affordable, but it's always the case. That's always the case. If you go to buy a house, you got to figure out which one you can afford. If you're going to buy a car, you may get an electric car unless you live out in the country and you can't get to a charger. So I think trying to say that, consumers are not in a position to make any of the decision process, I think is misleading. And I do encourage people to get as much information as they can about the things that they are considering. But I think it's really important to understand that anybody can practice portion control. And if you undergo bariatric surgery, you're going to have to pursue portion control. So you might as well try it now. Get yourself some measuring cups, get yourself a scale, and measure the stuff you eat right from the beginning of the day. And if you want to count calories, you can. It's a little bit too much work for me. And like I say, I'm really interested in sustainability. What can I do that I'll still be doing 6 months, a year, 2 years from now? That's not the case.